So we'll hear from Elaine Hyshka from the University of Alberta School of Public Health, then Petra Schultz, who's a co-founder of Moms Stop the Harm, Jared Wesley from the University of Alberta Department of Political Science, Chanel Tuan, who's Alberta board member for the Canadian Association of People Using Drugs, and Bonnie Larson MD from the Cumming School of Medicine at the University of Calgary. So I'll give you a time check at 6 minutes, folks, and make sure you wrap up by 7. So Elaine, would you unmute and kick us off?
So I just want to thank David for inviting me to speak on this panel. I think it's an important topic, and certainly it's very political, the drug poisoning epidemic in Alberta, but we don't see a lot of commentary around politics, in traditional media or on podcasts and things like that. So it's nice to have an opportunity to discuss that today. I just want to start, David mentioned statistics, but I do really think it's important to recognize the magnitude of mortality we're talking about here. In Canada, since 2016, we've lost 23,000 Canadians to apparent opioid toxicity. Alberta is particularly hard hit. We've had the highest death rate in the country consistently since this crisis started. And in the first 10 months of the year, last year, there was 1,247 fatal opioid poisonings in the province, making it the most deadly year on record, even with incomplete data. I think it's really important to note that First Nations people in Alberta are far, far more likely to die of opioid poisoning than members of the general population. And this inequity has widened dramatically since 2016. In 2020, the death rate per 100,000 for First Nations people here was 111 per 0.9, and that compares to 15.3 for non-First Nations people in Alberta. So it's important to note that if you look at this chart, the opioid deaths really started to increase in 2014 in the years following a number of policy measures that were implemented to crack down on prescribing and dispensing of pharmaceutical opioids. So the spike in opioid poisoning has really been driven not by an increase in substance use or addiction. There isn't a lot of evidence to support that, but rather by the entrance of highly toxic novel synthetic opioids like fentanyl into the illegal market. So these drugs have made it really challenging for people to know what they're taking and what dose at what dose, and that's led to substantial unintentional poisonings. Around 2019, we did begin to see a bit of a dip in fatalities, which was promising and likely related to declining volatility in the illegal market, as well as substantial new investments in treatment and harm reduction. But the onset of the pandemic really reversed this trend. Okay, so this is the graphs I was referring to, but essentially you can see here the trend really starts to take off in 2014. And here we see a substantial increase in deaths starting during the pandemic period in the second quarter of 2020. So how should we respond? Now, Alberta has really focused on, in the last few years, on 2 main strategies. The first has been a real emphasis on enforcement. And so that's interesting because we know that enforcement is not particularly effective for addressing drug poisoning. And that's for a variety of reasons, but in particular, there is a theory and some evidence to support the idea that as we escalate our efforts to crack down on the illegal drug supply actually gets more toxic in response. And that's because to avoid interdiction, traffickers will bring in stronger and more potent substances. And as a result, those substances are more toxic and more difficult to consume safely. And certainly the return on investment is much higher when there's a lower volume of substances that are being imported and then cut up and sold at distribution points to many, many people. And this is borne out in data from the United States, where you can see that as the supply control budget has escalated, we've actually seen an increase in the potency of heroin and a decrease in the price. And so by these measures, enforcement alone or enforcement-focused efforts have failed. The second focus has really been to invest in abstinence-based treatment programs, so residential treatment. And while these services can be beneficial for people who are using alcohol or stimulants, they are not typically recommended as a first-line option for opioid use disorder. And that's because there's a high risk of relapse associated with attending these programs if you use opioids. And this study kind of shows just that it's not an effective response relative to medications like opioid agonist treatments. What the study looked at was 40,000 people and their treatment pathways in the United States, published in JAMA in 2020. And it found that the only pathway that was supported by the evidence was opioid agonist medications, which reduced the risk of mortality and morbidity at both 3 months and 12 months. Detox and residential treatment had no advantage at all compared to no care for opioid use disorder. So what the evidence says from a public health perspective, which is what I come from, is that we really need to address, take a public health approach, which involves neutralizing the population health threat by focusing on modifying characteristics of the host, environment, and agent, which is the epidemiological triangle. So in this instance, the host is the person at risk of drug poisoning, the environment is conditions in which they live, and the agent is the toxic drug supply. So best public health practice states that we need to address all three components. And so examples of evidence-based strategies under these components are things like education and treatment, which make people less likely to use drugs and be poisoned. Things like supervised consumptive services and naloxone kits that can change the environment around the person and make it easier to get help in the event a drug poisoning happens. And then a further promising strategy is to help to reduce the risk of poisoning by replacing the toxic drug supply with pharmaceutical alternatives of known potency and quantity. And so this could be potentially quite beneficial because we do know that drug use is inevitable to some degree in society, and that not all people who use drugs require treatment. Many people don't have addictions, but they're still using substances. Beyond that, those that could benefit from treatment, according to many decades of epidemiological research, the evidence is clear that the majority of people at any given moment are either unable or unwilling to access treatment programs. So those are kind of the responses in a nutshell that would be supported from a public health perspective. And I just want to change tracks very quickly after providing that background to go over some recent research we did with Jared, actually, who's on the panel, looking at Albertans' opinions of some of these policy responses. So this is based on a survey of 824 people conducted between August 17th and 30th of 2020. So there's actually probably more consensus around these policies than you might believe if you just look at Twitter or listen to the news. The majority of Albertans in this sample agreed that we should be increasing awareness of substance use, we should be expanding access to treatment, and this did include abstinence-only programs, but also as well medication treatments like Suboxone and methadone. They also supported more physician care, as well as expanding general harm reduction approaches and naloxone kits. And there was also majority support for safer supply as well. Two more controversial policy options were supervised consumptive services and decriminalization. And in these instances, the support was very divided along party lines. So with regard to supervised consumptive services, 49% of people agreed with expanding them, and people who identified or affiliated with the NDP were most likely to strongly agree with their expansion at 41% compared to 9% of UCP members. With decriminalization, in general, 45% supported moving in that direction. And again, political affiliation was illustrative. 28% of people who identified as NDP supported it compared to 10% of UCP in terms of strongly agreed. So I'll just end there. I think it is important to take into account public opinion when we're discussing public policy, but as a public health person and someone that's been working on this issue for many years now, I do think we need to recognize that people who use drugs are highly stigmatized and vulnerable in our society. And I don't believe that public opinion should be the main determinant of the directions we move in terms of implementing life-saving interventions.
Thank you, Elaine. Over next to Petra.
Thank you, David, and thank you for the opportunity to present today. And Elaine raised very good points. What I will do is come in from a more personal perspective, especially as it pertains to my son, Danny, is where my advocacy work began. And when I present my story, always starts. Danny was our youngest child. He died from accidental fentanyl poisoning in 2014. If you look back at Elaine's graph, 2014 is where we saw fentanyl enter the market. And I always see Danny not as a victim of substances, but a victim of drug policy. Danny's substance use started in his teen as a way to cope with social anxiety. Like for many people, problematic substance use is related to mental health, trauma, or other challenges. Danny started with using oxycodone, which was OxyContin, which was widely available at the time, and later progressed to using heroin at the time when oxycodone was no longer made available. At the time of his death, he had been in recovery and relapsed, was unfamiliar with the market, and unbeknownst to him, bought fentanyl, which is so much more potent than what he had been using before. And he died alone in his home, just a short walk away from where we used to have a consumption site that the UCP closed from. He lived close to Boyle Street Community Services, a place that could have kept him safe and saved his life. So this is just a snapshot of Danny's story. There's much to be said about him, that he was a sweet young man, that he wanted a cactus for his birthday when he was 3, a gold panning kit when he was 8 or 10. He had an old Chevette when he was 14. He came out gay at 16 and faced stigma over that, which especially in school where he was bullied, and he struggled with that. There's much to be said about him, and we miss him terribly every day. And I know that Danny's death and all the deaths that follows were preventable. Just to put Elaine's numbers in perspective, we are losing 4 or 5 people every day, as you said earlier, David. When Danny died, 12 people died per month, and that was a lot of people. It is, every one person is one too many. These are some of the loved ones, a member of our organization, Mom Stop the Harm. We are an alliance of families across the country. We have over 3,000 members across Canada, over 600 in Alberta alone. And these are just a snapshot. And you see here that most of the people we lose are very young. The ages are between late 20s and 40s are the highest incident. Most of them are men, about 80% are men, and there are there's a lot one could explore around masculinity and the question, why do so many men die from drug poisoning? But you don't see in this picture here that Indigenous people are 7 times more likely to die in Alberta. We have some Indigenous members, but we find that for people who are often stigmatized and marginalized, it's much harder to speak out in advocacy. As an organization, sharing our loved ones' stories is a way to open hearts, and we hope that opening hearts will lead to open minds. And I've been doing this now for close to 7 years. And you reach a point where you say, enough, I don't want to hear another politician giving me expressing their condolences or telling me how sorry they are for my loss. I'm just really done with that, because what we want to see is actions for politicians. So last year we said, no more Mrs. Nice Mom, we are done being nice. And we are now taking more radical action together with our allies. I must say, where we are the strongest is when we work with our allies in Alberta and across Canada. Chanel will talk a little more about our action on December 16th, which we called Drug War Armistice Day. We participated in an unsanctioned supervised consumption site in Lethbridge. In 2020, our members were there together with the Lethbridge Overdose Prevention Society. That was sadly shut down by the relentless attacks from some of the fine citizens of Lethbridge, as well as the fines the organizers got. They got thousands of dollars in fine every day they were open. But they're still going out to do outreach and saving lives. The other thing I want to talk in more detail about is a legal challenge that we are currently involved in. So Moms Stop the Harm and the Lethbridge Overdose Prevention Society, we're taking the government of Alberta to court over new regulations for consumption sites. So Kenny is telling us that we are the first, Alberta is the first province to regulate consumption site. I would say first province to interfere, because these are well regulated federally. And they're very, very detailed regulations. I was involved in the applications and securing our locations in Edmonton, and I know the regulations are extensive. So what our legal challenge, we brought this about because we see these new regulations as a breach of the charter rights of people who use drugs. Particularly, there is a requirement for people to present Alberta healthcare numbers when they first access the service. And supervised consumption sites are a life-saving public health measure that is meant to be low barrier and not to throw any kind of obstacles in people's way. We also know from research that Elaine did, as well as an informal survey we conducted, that people, about half of people who were surveyed are either unlikely or will certainly not use consumption sites if they have to present a health number. There are other elements in this legal action, and I'm happy to answer more questions about that are problematic, such as the arduous reporting to AHS that'll make it difficult for organizations like Lethbridge to even operate a site like that. And there are so-called friendly neighbor agreements that allow every NIMBY in every neighborhood to block a site. We right now are seeking an injunction so the regulations can't be implemented until our court case is heard. That injunction request was denied, and our lawyer Avnish Nanda said his conclusion was the court found that preventing the death of marginalized vulnerable Albertans did not provide a greater public benefit than allowing the Alberta government to formulate addictions policy in an unrestrained manner, which was what the argument of the judge boiled down to. On this basis, we have appealed. And for those of you who are interested, our appeal hearing is on January the 27th. So we were very surprised and pleased to get an appeal so quickly, and we are hoping that we can forward to this legal challenge. I must tell you that as a small not-for-profit organization, as a bereaved mom, taking my government to court is not something I woke up with one morning and thought I'd really like to do that. Actually, it cost me many sleepless nights to come to this decision. But in the end, we concluded that lives are at stake here. And if our government is not engaging in dialogue and not willing to listen, we have no other option. As an organization, Moms Stop the Harm engages in advocacy as well as peer support. I urge you to check us out on our website, especially if you know somebody who might benefit from our support. Our advocacy is focused on 2 points. The decriminalization of people use drugs, which is, I have lost track of how many media interviews I gave this week on the topic. Councillor Michael Jans is on Monday bringing a motion forward to look at a plan to seek a Section 56 exemption from the Controlled Drugs and Substances Act for the city of Edmonton. So I urge anybody from Edmonton to write to your councillor, write to the mayor in support of this motion. You can see here that a lot of Canadians, the majority of Canadians, would support decriminalization. For us, we see it as important because it removes the stigma of substance use. And criminalization, as Elaine has shown in her graphs, criminalization harms individuals, it harms families, and it harms communities. And we've criminalized people for so long, and the only thing we have to show more for is more drugs, more death, more social disorder, and more people in jail. So if what you're doing is working, try another way. Just want to quickly show last slide at the website.
Thank you, Petra. Over to you, Jared.
Thanks, Petra, and thanks for sharing your story and your son's story. And you know, part of the challenge in addressing crises like this is appropriately framing them so that they gain the amount of public attention that Elaine spoke to. And so the government understands that this is a priority issue that must be handled in particular ways that we'll be talking about today. So I'm going to talk a bit about how, from a political communications perspective, the government of Alberta has approached this issue. I'm going to spend some time talking about how the government has framed the crisis, and secondly, offer some suggestions as to why that might be the case. So in terms of the how, again, it's important to think about public policy initiatives like this, not just from a position standpoint, what position does the government take, but what priority does the government place on this particular issue? And some of my research is focused on Twitter. Some people will say, well, Twitter is not the public, the entire public sphere. And certainly that's true. We've done some parallel studies on Facebook as well, but social media is not the entire public square. But I think it does provide us a window into what the government's priorities are, to the extent that if a premier is tweeting about something and tweeting about it often, it seems to be very important to the government of the day. So it's a very crude measure of this. I had some of my research team go through the premier's Twitter feed dating back to the day that he took office. And we find that over the course of that period, he used the term opioid 8 times, compared to oil and gas, which featured in over 249 tweets. Now, that's probably the hardest example, because we know that this government's priorities lie in economic development, particularly in the oil and gas sector. But it does demonstrate the extent to which this government has not prioritized this crisis that we're talking about today. It also is interesting that they have assigned the file to associate ministers, first Luan and now Ellis. And to the point where in 2021, neither of the 2 health ministers, Shandro or Copping, has actually mentioned the opioid crisis in their Twitter feeds, leaving it rather to the associate ministers to handle. It is interesting to me, and this is a surprising finding, that the government is not shying away from terming it as a crisis. They actually are talking about it in the terms of a crisis, but a crisis of what? It's important to unpack. For them, as we'll talk about in a moment, it's a public security or a public safety crisis. And the roots of the crisis lay not in unsafe supply or drug poisoning, as we framed this talk, but rather in the grander scheme of opioid availability. I'll talk about that in just a moment. So secondly, we've seen the government, particularly since the onset of the pandemic, linking the opioid crisis, the drug poisoning crisis, to the pandemic in several ways. Right? They've talked about how lockdowns lead to isolation. The pandemic has led to job insecurity, and overall fear and anxiety can push people to overuse, in their mind, overuse illicit drugs. Fourthly, they've suggested that it has resulted in a lack of access or diminished access to in-person treatment services. And lastly, probably most controversially, they've suggested at one point in the pandemic that access to federal relief funds increased the demand for illicit drugs, including the ones that we're talking about today. So they are linking this issue to the pandemic in a way that we don't see across all issues. Thirdly, they're framing it as a need to balance or rebalance the government's approach to the opioid epidemic. So whereas previous governments have focused on harm reduction, individual suffering, and social justice, and framed it in those ways, and other governments across Canada have as well, the UCP is prioritizing, as Elaine mentioned, treatment. They're focusing more on the societal costs and impacts, and here they're talking about crime and quote, social disorder as being the main problems that need to be addressed. And thirdly, they've emphasized at different points the importance of ensuring that small businesses don't have supervised consumption sites or similar treatment and harm reduction facilities in their neighborhoods, because it's cutting down on their business. So it's a very interesting reframing. I say interesting, but also somewhat predictable, because I'd like to use my last minute or so here to talk about why the UCP takes this approach. It won't surprise many folks that from an ideological perspective, this makes sense. If you look at the 2018 UCP policy declaration, which I've said in many different forums is the clearest definition of modern Western Canadian conservatism ever put down to paper. It was carefully constructed. And this government is very ideologically coherent in its approach to public policy in this issue and others. I don't have to go through everything that's on the screen right now. You can, as people that are interested in this issue. determine how the government has been really framing this issue. I just used yesterday's press conference as an example where the premier referred to drug addiction as a personal choice, which links back to their main principle of personal responsibility. But I'd also like to suggest that we're entering year 4 of an election cycle, and a lot of the treatment of this crisis has to be viewed through a political communications lens in terms of how the government is trying to frame itself to voters in the next provincial election, which is expected within the year or just shortly after, just shortly outside of a year's time. The premier's facing a leadership review. Party financial updates are often a good barometer of the health of a political party. They've got their final budget before the next election. And then we enter that critical red zone where the government is gearing up for an election. So this all, putting on my political science hat here, this all makes sense from a political standpoint that they would not want to talk about this issue. We know from public opinion data that the UCP is not trusted. They do not own the issue of public health. And as a result, they will want to de-emphasize this issue. And if they have to talk about it, they want to link it to another issue, as I mentioned before, like the pandemic, to try to frame it in a different way. So they want to reduce the overall saliency of the issue, not talk about it much, and then want to reframe it in ways that allow them to talk about issues that Albertans trust them more on, in particular, the economy and public safety. So with that, I hope I've lent some insight into how the government has approached framing this issue publicly and some possible suggestions as to why. Thank you, David, for inviting me here. And it's fabulous to be on a panel of such experts in this area.
Thank you, Jared. On to you, Chanel.
Thank you very much. Wow, it's been a round of really powerful speakers and some very excellent points made. So I haven't prepared any slides. I haven't prepared any remarks. I came to this conversation today kind of with an open heart and an open mind, and had my smudge beforehand, making sure to alleviate me of any negativity that I may be holding inside of myself. And so the reality, I think, really to touch on Elaine's initial point of enforcement leading to bigger issues. And so Elaine shared with us a slide showing, of when we think we're doing good by making one thing, enforcing one thing, it always leads to a bigger issue. And I can actually, I guess it would be considered anecdotal evidence, but being on the front line for the past 10 years, I can honestly attest that after that amount of time, it really does lead to bigger issues. And so we've only seen stronger drugs come in, the poisonous drugs actually come in and land in our streets and in our community. And so after, hearing evidence from public health and hearing Petra share her personal story, and Jared with the political perspective of how things are kind of going, I just really want to kind of reframe for myself. I come to this. So as an Indigenous woman, I am Carrier Shuswap. I come from the Caribou region of British Columbia, but I have been a resident of Edmonton for the past 36 years. And working in Edmonton in the inner city for the past 10 years, I can honestly tell you that when we see things like graphs and bars, and thank you, Petra, for sharing continuously Danny's story, and Danny has provided a legacy for his family to carry on and be able to have his story shared, that potentially hearts and minds are opened for people to be able to understand the grave impact that this has had in community. So we did hear from Petra and her story, but when we take into consideration in Elaine's graph that each of those numbers, and that's the really hard part for me, because I'm so connected into community and spend a lot of time with community members. And it's really kind of gut-wrenching and heartbreaking to hear people, kind of the numbers. And oftentimes that we hear the numbers and statistics. Today, even I can let you know of 2 emails that I received that were death notifications. And now this is not, so previously, since probably about 2016, when we seen fentanyl really come into the scene, I attended funerals monthly. Unfortunately now, due to COVID restrictions, funerals are kind of been put on the back burner for a lot of families and folks, but I'm still now, instead of attending funerals monthly, I am getting death notification emails weekly, if not daily. Sometimes there are weeks where every day you're receiving a death notification email. And these, to me, these aren't statistics, these aren't numbers, these are people and members of our community. And so oftentimes, you know, we often give land acknowledgements at the beginning of all of our meetings, and we're really kind of intent on moving forward in at least some certain circles and communities, networks. And anyways, for me, it's really about a radical act of reconciliation. If we take into consideration what Petra shared with us, that as Indigenous people, we are 7 times more likely to end up in the morgue. And you know what I mean? I honestly, it's just, for me, for the political side of this, it's really hard to kind of digest that the government response to a fentanyl poisoning emergency in our community is to have refrigerated trucks situated behind our morgue to hold the people of our community in, is really gut-wrenching, and something that actually, you know, leaves me with nightmares, and makes, I have also some sleepless nights, Petra. So I share that sentiment with you, and it's sometimes very visceral. But if we take into consideration, you know, poverty and houselessness and colonization and the Indian residential school system in light of what we've seen across this country. And so be assured, I can assure you, being connected into CAMPP, that this is happening in our community, and oftentimes in conversations, Alberta ends up the butt of the joke lately. But just that, how we can actually, you know, when it comes down to missing and murdered Indigenous people, the Indian residential school system, in light of what's happened across our country. And we're talking about, you know, now the children who were taken in the ground, but what about the survivors? So the people who did survive residential school, and these make up probably the majority of people have connections into this, that you know, if we're taking a group of people who have been severely traumatized and had all of this intergenerational trauma, we should be offering supports and services as best we can. So I see decriminalization almost as a radical act of reconciliation, of saying, you know what, we recognize that many people didn't make it home, but what are we doing for the people who survived, the people who are still out here in the street? And we really need to kind of bring the focus back that, you know, the government shouldn't be looking at statistics and numbers. They should be like connecting with Petra Schultz and Mom Stop the Harm, and come down in the community and meet people, and then you would see how hard it is to actually just be able to kind of turn a blind eye to the current situation that we face and the reality that we're dealing with right now on the street. I'm sorry, I think I've eaten up my 6 minutes, but I look forward to the rest of the conversation. Thank you guys very much.
Thank you so much, Chanel. So the last brief presentation will come from Bonnie, and then we'll move into the roundtable stage. Bonnie.
Thank you for inviting me to participate in this very important discussion today, alongside such incredibly intelligent, thoughtful, compassionate, and fierce experts in the drug poisoning crisis. By way of self-introduction, I am a family physician. I am a white settler on Treaty 7 land. I'm in Calgary. And in my clinical practice, I work mostly with Indigenous people through the Alberta Indigenous Virtual Care Clinic and on the Tsuut'ina Reserve, and also with people who are experiencing homelessness and or use drugs. And I've done that for my entire career, which has been about a dozen years now. I'm really pleased to be part of this interdisciplinary conversation. As an anthropologist, prior to studying medicine, I've had the opportunity to be educated and experience a variety of worldviews and perspectives. And I truly believe that these kinds of complex problems require many diverse minds to solve. My comments today are nonpartisan, and they stem directly from everything I do, stems directly from my experience with my own patients and observing my colleagues' practices and things that I have learned from working closely with people who have, like yourselves on this panel, very deep knowledge of the drug poisoning crisis. Honestly, I was never interested in politics at all. I really resonate with what Petra said about, you know, I didn't wake up one morning and think, okay, I'm going to sue my government. I just was never very interested. And actually, I feel compelled to disclose that political science was like my worst grade in my undergraduate degree by far. So I feel really lucky to be here today. So I bring a perspective of both an advocate and care provider combination. I feel that all medical doctors have the privilege of caring directly with people for patients, including for people who use drugs. And we also are ascribed and or maybe eventually earn power and position to advocate for system level change, so that image of from the grassroots to government and sort of back again is a space that we can occupy. Physician's job includes advocacy. So sometimes, you know, people will say, well, what are you doing? You know, activism is not part of, you know, stay in your lane. It's not part of your job. It is literally written in our job description to advocate for our patients, and everything I do is oriented towards health equity. So quickly, I'm going to speak to what physicians can do as clinicians and advocates, and then maybe talk about some of the barriers, and we can maybe follow up during the roundtable and Q&A about what the barriers are to providing evidence-based care to patients and populations, but unencumbered by policy and ideology. Okay, so, you know, and during the presentations, I've added to this list because I feel like all three of the public health sort of pillars or components, person, environment, drug, the drug or pathogen, we sometimes think of, you know, a disease pathogen, like these are the pillars of public health. Physicians have roles in, you know, potentially can play and help in all of these things as they relate to the drug poisoning crisis. So what is happening is we are very encumbered by policy and not able to use like sort of the skills and knowledge that we may have to help end the crisis. So things like we can pitch in with, we have the knowledge and skills to do things like prescribing, like, you know, screening for, diagnosing and treating substance use disorders, including being able to get people very quickly onto treatments like opioid agonist treatment or whatever other treatments are indicated for that individual. You know, I would point out and reiterate the piece about opioid use disorder not responding better than nothing to residential treatment and detox, which is quite interesting when you have a patient sitting in front of you saying like, I would like to go to treatment, because they've been conditioned to say, like, to either say that as like sort of like to get you on their team, which is unreasonable thing to have to do, in my opinion. And also often in my patient population, the reason they're going to treatment is not because they think it's going to help with their substance use disorder, but because they need a break from the streets. And so that is another way that we can sort of pitch in. These are all things that I have done with patients, so I know that it's possible, but under the pressure of a variety of barriers. And it's not always comfortable to like accompany or spot a patient, for example, in the alley behind the clinic to make sure that they don't, you know, suffer some kind of ill harms from their drug use. So I'll go with them while they do that. It makes for a smoother clinical encounter as well if people aren't withdrawing or just itching, or sometimes just need like a cigarette, and then and that's a nice way to kind of let them know that their needs come first, and we can do that. We can provide more health supports and shelters and supportive housing by doing things like home visits, drug checking in terms of like the capacity for medicine to pitch in. There's a whole realm of toxicology that could be, utilized and maximized. And then things like, we were talking about deprescribing in 2014 and this pressure that came in. When I started my training, it was like people were sort of like at the tail end of the Purdue marketing, where physicians were really like persuaded to treat pain with OxyContin and things. So I kind of got in a little bit after that, and so it didn't affect me, I think, as much as it had generations prior in medicine. But the thing was that very rapidly there was pressure on physicians to deprescribe, like attributing the cause of the drug poisoning crisis to not the poison, but the prescriptions. It created this assumption that if we just took that away, that would somehow solve the problem, and it didn't solve it. It made it far worse. So we need to be very careful about deprescribing, and tapering has to be done extremely carefully, very slowly, and in partnership with patients. And doctors are able to do all of those things.
Thanks to all of you. There are so many overlaps and connections and so on. So I just wanted to open the floor to any of you who want to ask a question of another, ask for elaboration, tag on to what somebody else said. There were quite a diverse array of presentations, and this feels like an opportunity. Chanel, please go ahead.
Thank you. So actually just listening to Bonnie, what you were just saying, Bonnie, actually really resonated with me, just because I've come into this work. So back in 2012 is when we really started to see fentanyl coming onto the street. And so really what you're saying, it absolutely, and I know this is, I guess, from my perspective, what they call anecdotal evidence, but really over the course of the past 10 years, that really rings true, because we've seen what happens in community. So people aren't dying from death from ingestion of a safe, predictable source of medication. They're dying from the alternative, which is when you can't access a prescription from a doctor and you're left to self-medicate with whatever is on the street. This is where we're seeing the majority of deaths come from fentanyl poisoning, and that's due to the lack of access that actually. So that had obviously unintended consequences, but oftentimes in circles, I'm absolutely surprised lately how much politics has actually come up in conversations. So yesterday I was at a drug user group meeting where you wouldn't think a bunch of people who were current or former drug users would be sitting around and talking about politics. But I'm telling you, in these circles, this is absolutely happening. And it's just really, yeah. So I just wanted to, you kind of hit the nail really on the head there, Bonnie, because that's exactly what I've been seeing over the last decade.
Thank you, Chanel.
Of our families, we are so grateful for physicians like Bonnie, for people who do work on the street, Chanel's team, and the work that Elaine does around policy and such. And it is so heartbreaking to see barriers thrown in the way of people. Like physicians like Bonnie, we should clone, but it's really, really hard to just find people actually who will prescribe, especially safer supply, which saves people's lives. That physicians who do good work, people who do good work like Chanel, people who do good work like Elaine, they actually face threats in our political climate, face threats to their position and their livelihood. And often we as advocates are the people who are left to be able to speak our mind without fear of persecution, because we don't get funding. Well, we get, our organization, we have federal funding for our family support programs, but we have no provincial funding. So it's a very unfortunate situation where people can't even do their job because, as Bonnie said, advocacy is part of everyone's job. We have to advocate for the people that we are serving and supporting. And that is such the political climate at the moment in Alberta is really hostile to anyone who opposes the mainstream. It's dangerous to anyone who opposes the mainstream. And what this does, it creates a climate where it becomes difficult to find real good evidence-based solution if they're kind of going against the prevailing grain. Would be interested to hear what Jared has to say about that.
Yes, thanks, Petra. Actually, we've done some focus groups as part of our Common Ground project across Alberta. We've been before the pandemic, obviously, because we haven't been able to face-to-face with folks. And part of our exercise is we ask our participants to imagine the typical Albertan. We ask them to imagine who is the typical Albertan, draw them for us, name them. It's an interesting exercise in and of itself. And then as a group, they have to come to consensus on who that typical Albertan is. And usually it's Joe the cowboy, Joe the roughneck, Joe the redneck, and so on. We do that because we want to try to get a sense of not what people's personal opinions are, but what is the view of the mainstream, quote unquote, mainstream Albertan. And when it comes to substance dependence, I was actually taken aback at how people think the mainstream Albertan, Joe, actually views this crisis not through the lens of personal responsibility, but through the lens that we're talking about here today. So we posed to our focus group participants, we put a picture of a person who's on the street, living rough, and most of the participants concluded that they were there or with substance problems, right? Substance challenges. And we asked them, how did that person get there according to this quintessential Albertan? How does Joe think this person got there? And what we heard was fascinating. He said, well, Joe knows people like that. If Joe works on the rigs, Joe knows and has friends who have gone through that. Joe's family has experienced this. This crisis has reached into so many different communities. It's now part of the mainstream discourse, and people aren't othering it anymore, right? They're not othering it because they know somebody and they can empathize with people that are in that position. Now, if Alberta is a quintessentially conservative province, what we know from political science research is conservatives, small c conservatives, will empathize with people if they know somebody who's gone through that personally. And that's the sad state of this crisis, is that so many Albertans have now been exposed to this personally that they've changed their views and are not relying on the ideological cues that have made up our historically conservative political culture and the government's approach. So in a sad way, I'm actually optimistic in that I don't think the framing of this as a personal responsibility or choice issue flies with mainstream Alberta anymore.
I just wanted to reiterate, I think to summarize that piece about the level of political interference with what I think of as care provision is really extreme these days. There are virtually, as far as I can see, no institutions that aren't under government's thumb, and community engagement is an illusion, and it is often a setup. I've found Jared's framing to be validating in the sense that is, it's not subversive. That is their policy statement. And I just think that, when I was working as an anthropologist in Latin America, we used the explanatory paradigm of oppression very commonly. And I'd never thought I would be here at home saying that I think it's time to give that framework some serious consideration, given our current situation.
It's that interference doesn't just go towards advocacy or people that are speaking out publicly, but it also has interfered with science directly in the province. We have an instance where there was a peer-reviewed randomized controlled trial funded to evaluate an intervention to prevent opioid poisonings. It was a telephone line that was funded by Alberta Innovates through a competitive peer-reviewed competition. Alberta Health Services got several $100,000 to do this randomized controlled trial, and the government interfered and canceled the funding and canceled the pilot. And I've never seen that happen in any jurisdiction that I'm aware of in North America, that kind of level of interfering in peer-reviewed science. I think another example is these reports that are coming out on the topic. In particular, like we've seen the Supervised Consumption Services Panel review report. There was $200,000 in that budget for honoraria for the panel, presumably the panel members, which was never disclosed publicly. We aren't seeing like the same standards of even just like high quality evaluation, let alone scientific review, applied in these instances. But then those reports are being treated like independent and credible evaluations of interventions. And I think it's really unfortunate because it's undermining public trust in science and in academic work when we see that kind of interference in the process. So that to me has probably been one of the most alarming things in the last couple of years that I've been watching unfold here.
Thank you. So there's a question, I came into this just knowing what's on the agenda in Edmonton on Monday, thinking about jurisdictional issues. So there's a question about what will happen if Edmonton or Toronto actually pursue this line of requesting the exemption that would lead to some form of decriminalization of minor possession. But there's also a question in the chat that asks about the Canada Health Act and whether there is room to appeal to the federal government around drug poisoning deaths, given that they are so closely connected with medical facilities in the 30 days preceding. So I just wonder, Jared or others, whether what you have run into at the level of activism or analysis around federal, provincial, municipal jurisdictions and how that either enables some avenues or closes some avenues of response to the drug poisoning crisis.
Yeah, I'm not sure that the Canada Health Act is the lever. Historically, federal governments have been very reluctant to crack down on provincial services that are offered and funded through the Canada Health Act and Canada Health Transfer. And I don't believe, folks that are health policy experts can correct me, I don't believe the Trudeau government has actually used the Canada Health Act as a lever to force or to encourage governments to pursue a particular course of action. That doesn't mean that the federal government is impotent in this area. They do have the ability to spend. They do have the ability to build programs on a national and even on a regional scale. So my focus wouldn't be so much on the jurisprudence of the Canada Health Act or force it or trying to encourage the federal government to cut off health funding to facilities that aren't meeting this crisis in an appropriate way, but maybe putting pressure on local representatives. Local MPs who are part of the government cabinet can help.
Petra?
One thing, I was fortunate to have a meeting with the Federal Minister of Mental Health and Addiction, Carolyn Bennett. And one thing we asked our Leslie McBain, our other co-founder, and I, that the government tie any funding that goes to provinces to address mental health and addiction, and they have identified a significant dollar amount of funding that they are going to be sharing with provinces, that this funding should be tied to outcome indicators. And the analysis we used, we pointed to the childcare deal. Provinces didn't just get childcare money that they could turn around and give to middle-class families to hire nannies, but it had to be childcare money that was spent on licensed childcare facilities. And we would like the same kind of funding deals for any funding in this field, that the federal government clearly identifies what the money should be spent on and how, in order for the province to access the money. Then, of course, we need enough public pressure so people people care and the money is not just left on the table. In terms of our legal action, we have also reached out to the federal government because supervised consumption services are federally regulated, and the federal government would have the power to put it in kind of non-legal terms, to tell the province to stay out of its lane. But we are not sure if there is a willingness to do that on part of the federal government, but we are certainly, that is one of the asks that we have. And there are things the federal government can do that are outside of the Health Act.
There are several questions that relate to activism, how work is going on or could go on across different stakeholder groups in mobilizing for changes. And then a third question that could perhaps be linked in that has to do about what's happening in terms of advocacy for safe supply. So anyone who wants to come in on one of those angles or how they connect with one another.
I can come in at a very high level, and I'm going to come in with optimism. For the reasons I stated earlier, the mainstream view of this crisis is no longer one of personal responsibility. I think the first key to this is for Albertans who feel marginalized in this debate to recognize that they outnumber the number of people who are trying to frame it in a different way. So part of our research, we're just fascinated by this. We're doing public opinion research through surveys like Elaine highlighted in her part of the talk. Public opinion surveys that show, for example, Albertans are very much in favor of the harm reduction policies that we're talking about today. And yet there is an assumption by government that that's not where the mainstream Albertan is on this issue. So the first step in this is to recognize that you're not alone if you want to approach this from the angle that we're hearing today. And once I think enough people realize that they're not just, they feel marginalized, it's just them, that can help to provide some confidence, I think, that's needed to tackle this issue and frame it in the proper way.
I can talk a little bit about advocacy for safe supply just quickly, given that we just came from the Globe and Mail opinion to try to clarify sort of nationally where physicians are at in terms of prescribing safe supply. But provincially, where we're at right now is where I think it's a parallel. It's like deja vu or Groundhog Day to where we were at shortly before during the supervised consumption services panel, which was supposed to be a community engagement process that was to yield a report, which was roundly discredited by experts. And so I think that right now, this is what's happening with Safe Supply, is this setup so that, this group, a committee is put together by government to basically execute an agenda. In my opinion, I think that's what they did with the supervised consumption services report. And we were not, right now, we are way more prepared, I think, for understanding what that process actually is and hoping to get in front of it and leverage things like we understand that people do support safe supply or safer supply, both prescribed and community-driven solutions like compassion clubs. And so I think I'm hoping that we are more ready to respond to a potentially negative outcome with the report that is going to be released in April by that commission. I hope. The thing about safer supply, at least prescribed, models, is that it's one small piece. It's not it needs to be in conjunction and partnership with things like decriminalization It needs to be, like everything else, supervised consumption, all the models of care need to be diverse, because there is not one thing that works for everybody. And so what physicians can do is brush up on what things can we use. There was a question about heroin-assisted treatment. Yes, we can. I would love to be able to prescribe heroin for, or a pharmaceutical diacetylmorphine, which is pharmaceutical grade heroin, for patients that it's indicated for. We can't get it. There isn't any that we can actually like prescribe. And that is systemic issue. I mean, there is a whole bunch that's sitting in a warehouse in BC right now, that the prescribers that would like to, be treating patients with that are not able to access, and those are for political reasons. So I'm not as hopeful, in part because even though, it was like 2 of us at the McDougall Center in Calgary, kind of like in the freezing cold, like saying, hey, they're releasing this report, we have to be here and respond to this, when it was a supervised consumption report. Like we're way more robust in terms of a community to respond to that now, but they still use that report. And in fact, it is influential in other jurisdictions than Alberta, which is doing real harm in other places. And so I don't know, like, even if we are able to show with data and good science, like we are already seeing the results for safe supply programs in other jurisdictions that are very positive. And I know that we have, because they're my colleagues, willing prescribers here in Alberta, probably not a lot, but we have some, and they are ready to do it and know what to do and happy to do it. And boy, if we could get our hands on diacetylmorphine for that purpose, that would be really nice, because it is actually a nicer medication to use. So
thank you, Bonnie.
Yeah.
Chanel, did I notice you unmuting to come in?
I did, really quickly. I just, Bonnie, what you're saying is really resonating with me. And I think really in the community, it was probably noticed that over probably the past year and a half, well, really throughout COVID, my advocacy work has really shifted. And so I have been less vocal and present on social media platforms to say anything, because really here, many of us know each other. And for me, sometimes it often feels like singing to the choir. And so I know these are all like-minded folks who get it, who understand, who are, as the kids say, are woke. And the reality is, so for me, I really had to shift my attention and my focus to where I thought it could make the biggest impact. And for me, really, that has been in community, on the ground, connecting with people. So just to touch quickly on Armistice Day. So that was something that was a collaborative initiative that happened here in the province of Alberta, and it happened both in Calgary and Edmonton. And unfortunately, here in Edmonton, we were kind of issued notice through back channels, potentially from our police service, that anyone who was to be participating in an overdose prevention site that day may face actually criminal action against them. And so really that was a disheartening feeling to know that, if you're out here in the street trying to help save lives, that you very well may end up in some legal with some legal issues. So Armistice Day for us was really about then what can we do to come into community and support the people who are actually living this reality every day. And so we were able to raise some funds, raise some donations, and collaboratively. And so for me, it's really been about connecting with the grassroots organizations, the folks who have boots on the ground, that are out here every day doing the work, not mandated by government, not being paid by anybody, but as individuals who have been personally affected by this in community. And so really, it's about really helping build capacity within those grassroots organizations, and helping to form a larger collaborative community that's all kind of potentially addressing this situation that we're seeing reality in the street, because the people who are potentially responsible for dealing with this, let's just say that everything happens really at a glacial pace, if anything at all. And those conversations about politics are happening, not only in drug user groups, but also in the streets. Recently, I had somebody, it struck me, I just wanted to share, a community member had said, It was on one of the last weeks here where it was really cold, and oftentimes, we don't think of people who are living in houselessness situations on the street as having a political opinion. But one of the community members had said, when they were realizing that they could not gain access into the facility that they were trying to because of public health restrictions, and so the lady had stated, she said, well, the government is, she said, I'm the one that's homeless sleeping outside, but they're the ones that act like they have ice in their veins. And so that really kind of resonated with me and stuck with me. So if I think the reality is people are having conversations about politics, and it's happening everywhere. Yeah.
Thank you, Chanel. I'm going to suggest that we do a last round of a couple of minutes each. I'll put a couple of questions on the table, but talk about whatever you most want to talk about. The questions I'd put on the table, one is Bonnie had talked about the different moving parts of an adequate response. And someone asked, what about residential abstinence-based treatment? Is that part of an effective response? So that's one thing you might want to touch on in your 2 minutes. And then there are a number of questions that ask about what can I do, including what can I do as a racialized person watching what's happening. And so if you wanted to, for those people who leave this webinar wanting to do something to support their neighbors who are at risk of drug poisoning, are there one or two things that might be ready to hand for them that you would suggest they're doing? So take 2 minutes, feel free to address those or anything else that feels like a missing piece. Petra, why don't you start since your hand is up?
My hand is up because I've been, while this webinar is going on, chatting with one of our moms who's desperately trying to keep her son alive. Her son is somebody who is houseless in one of our big cities. She's an activist, an advocate. He's been stabilized on 2 types of opioid agonist medication, Cadian and methadone. But as a houseless person, he would like to get into treatment, but the abstinence-based treatment centers will at best take him on Suboxone, but not on Cadian and methadone. So he needs to detox, but the detox is closed for 10 days because of COVID. And her comment was, to me, it seems like the government with their policies is actively trying to murder my child. These are her words that I'm quoting. And when we look at how abstinence can be an option for a person. My son tried abstinence. He went through a cycle of detox and relapse until he finally went on and got on medication. We have to stop equating abstinence with recovery. Recovery for people comes in different forms. If it comes as abstinence for somebody, that is great. That if that works for the person, wonderful. We have to respect that. We have to support that. But for the vast majority of people, that is not the way to go. And we need to offer solutions that are indicated by the medical evidence that is provided. And just thinking back to the pain and suffering that my friend and her son are going through right now, these are systemic barriers that are thrown in our way that cause the death of the people we love. What people can do, from my perspective, 2 things: pick up a naloxone kit, free at any pharmacy, learn how to use it, carry openly so that you know. If you're a business, join the group. Each and every Businesses for Harm Reduction, they're a fantastic group that help us promote harm reduction in our province and have done amazing work. Also, write to your MLA, write to your MPs, demand these kind of strategies that we've discussed here today. And if you live in Edmonton, write to your city councillor and support Michael Jan's motion for Monday so we can move forward, be one of the forward-thinking cities in this country that move forward with decriminalization. Thank you.
Thank you, Petra. Elaine, we haven't heard from you in a little bit. Do you want to come in next?
Sure. So I say this as somebody that has been on the board of a residential treatment program and has done a lot of research actually in residential treatment programs back in my earlier days. I support investing in the residential treatment sector. I don't support using that as an excuse not to take action on addressing drug poisoning. We know from the evidence that the most effective treatment is with medication. And what I have been very troubled by is a reframe that, by the current government and also honestly by the previous government in their early days, that beds and residential treatment is the way out of the situation. It is an effective option for some people, certainly people who are using stimulants or alcohol, but it's not necessary. It's not been shown to be effective for people who are struggling with opioids. And not only that, it can actually increase the risk of death because people go through a short-term period of abstinence when they go to these programs, often for as little as 30 days. And then the relapse rate can be up to 80, 90%. And they return to use and their tolerance is way down. And then they end up overdosing or being poisoned and dying. And certainly we see and have heard many anecdotes in the last few years of that happening to people in Alberta. So I have no qualms with making investments in that component of the addiction system, but it really should not be framed as a situation, as a response to drug poisoning. And so I think what I would say people can do, which is maybe not as direct, but is to understand the roots of the crisis and really do some work to do that, because there is very popular narratives here that, it's just a crisis of addiction or it's a crisis of prescription opioids. Well, back in 2012, we had 1 in 5 people reporting non-medical prescription opioid use in this country, and we only had about 100 people in Alberta dying every year. Now we have maybe, who knows, 1,500 people will be dead. We won't know because we don't have the statistics yet, but we're well on our way to that for 2021. That's a substantial increase, and that is driven by the toxic drug supply. And certainly all evidence to explain the surge that we've seen during the pandemic, a lot of it is pointing to increased volatility in the illegal drug supply, whether that be through increasing contamination with benzodiazepines, which is being seen in the streets in Edmonton and Calgary, or continuing co-use of stimulants like methamphetamine. So it really is the issue, the supply. And if we're not doing enough to support people to connect to pharmaceutical grade alternatives, I really do worry that we'll never get on top of this. So please just try to understand the roots and think critically about what's driving this epidemic. And I think that will go a long way to illuminating the potential policy solutions here.
Thank you, Elaine. Bonnie, then Jared, then Chanel. Do you each want to come in briefly on whatever you feel needs saying? You could keep it under 2 minutes. That'd be great.
I'd like to typing away answering these questions in the Q&A. So I would reiterate the things that Petra and Elaine have said, and keep in mind that it's not that we don't know what to do. We know what to do. There's really good evidence on all of these interventions that simply we are politically prevented from implementing. And so I would say, if you're going to do something, think very carefully about how you are going to vote in 2023.
Thank you. Chanel, is there something you want to add?
For sure. And so really, I guess to just kind of wrap up where I'm coming from, I have a couple of things that, that I could share that might be helpful to folks is really to touch on Jared's point that this is really permeated into all communities and to families and neighborhoods across the city. We've seen that for many years now. But the reality is, I have kids in elementary, junior high. When I have, a 14-year-old who comes home and says, I have a friend who at school who his brother passed away from an overdose. I mean, it really has permeated our communities. And now we have families that are connected, that are being destroyed across our province, across our country. But for me, I would say if you really wanted to do something, it would be to have straight up and straightforward conversations with the people around you that you love. Oftentimes, they say, think of the children. And I say, for me, it's really about reframing it. So when I just say no if you're having conversations with your kids, but let's change that no to KNOW, and just really it's about know your dealer, know your source, know your limits, and really it's about if we're going to have good and honest, truthful drug education, let's have it honestly from the heart that actually is doing to favor prevention. But at the same time, we have to recognize that the reality is many people who are being killed by these, many people who are dying from these poisonings are not addicted, people who are not addicted. And so oftentimes, right, it's always, those people are othered, but the reality is it's everybody. It's happening, everybody in families across the country. And I guess, so I would just really like to reiterate, if you're going to have truthful conversations, but just recognize that many people aren't addicted, and it's first time users, it's experienced users, it's really permeated and decimated communities across the province and across the country.
Thank you, Chanel. Last word to you, Jared.
Well, thank you to everyone for sharing their perspectives on this, and thank you for all the insightful questions. Look, governments across the world misjudge the public mood all the time, okay? It's hard in Canada and in Alberta, given the data that we've clearly showed you today for this government, the present government, to misjudge where Albertans sit on the priority of harm reduction. Albertans are very much in favor of it. So the misjudgment here is on how much Albertans actually care about this issue. I come back to prioritization. And for those of you that feel like you're screaming into the night, I offer you 3 words. They all start with C: coal, childcare, and curriculum. All 3 of those issues, the government was offside of public opinion on. And from my sense, misjudged just how much Albertans cared about those issues. So coming back to Petra's point, and I get blowback on this all the time when I suggest to people, call your MLA. On all 3 of those issues, we have tangible evidence that enough calls came in, not just to opposition members, but to government members, that it changed the government's course on those 3 policy issues. You can change the government's course on this policy issue if you start calling your MLAs. It may not be in this next sitting of the legislature. It may not be in the next budget, but it may actually help to prioritize this issue and this framing of the issue as a harm reduction one for future leaders that may be on any side of the political spectrum. Thanks again for the time, and thanks for convening this, David.
Thank you so much to the 5 of you. This has been a rich, heartfelt, information-filled conversation. I really appreciate it. And thank you to all of the people who attended, posted questions. We didn't get to them all, but I'm definitely going to make sure that all of them are in the hands of all of our speakers who can find ways to reflect and weave them into other engagements that they're part of. So thank you, everyone, and wishing you all well in the days ahead.